Mr. Sandman. Hey, do we have sound? We do have sound. Hello.
Hello.
Welcome to Chat with the Docs, the only show on YouTube where you will have no cowbell and it'll still be perfect. I am one of your hosts, Mo Wolf. I'm the acupuncturist and head cheese. I'm not going to say it that way. I'm the acupuncturist here at the Salome Center. This is...
I'm Dr. Noel. I'm the chiropractor here at the Salome Center.
She's the head crack?
Nope, just the chiropractor here at the Salome Center. We're not gonna go down the hole.
We are your professional quacks. But we don't fly south for the winter, so you got us all year.
I just keep ducks.
We used to keep ducks, but then a fox got them.
Rest in peace, little buddies.
Yes, well, rest in pieces right now. We have one male left.
Oh, you still got him. Okay.
We still have him. He took up smoking after the fox attack.
That's understandable.
And at night, you always know where he's at because you see the little glowing end of a cigarette, and it's always on. And he might go through 3-4 packs a night. He's an expensive duck.
How does he light those cigarettes?
Just one into the other.
So you got him started, and then he just keeps it going.
I didn't get him started. I think there was a crow that was flying by and said, "Hey, Mac, I got this for your anxiety." And now he's just, in the morning, he's got his cigarettes and he's got his coffee, and he's one nervous duck. He thought he was a chicken for a little while.
You told me that.
And
identity crisis.
He had an identity crisis, and now he's not sure what he is.
Except nervous.
He's nervous. Sweet guy, though. Take away his flock, and all of his toughness left him, and he likes to be near people now. He's a sweetie.
Aww.
Welcome. Did I say that? I said that.
Yeah.
Can you tell I'm a little loopy today?
That's okay. It was a full moon yesterday.
It was a full moon last night. I slept in 2 hours this morning. I got up at 7.
Did you forget to set the alarm?
No. I was going to bed, and I thought, because I got home at around 10 last night. It was a late night with patients. I got home at 10. By the time I'm done eating dinner, there go my parents. You can hear their car. By the time I got done eating dinner, it was super late. Mercy Joy and I were watching something on YouTube, and went to bed at around 11:15, and I was going to set the alarm for 5, and the Lord said, "Don't rest." So I thought, okay. So I slept in until 7. Wow.
Needed
I can't
it.
believe people live like this. Let's jump in, shall we? This, by the way, if you want to call the show and be a part of the show, call us at 608-314-8791. I'm sorry, we're too cheap to have an 800 number. Maybe if more of you would like and subscribe, and we got some revenue coming in from YouTube,
I think we'll get.
then we could afford an 800 number.
We'll probably get blocked if we get an 800 number. It's like more spam. Black.
1-800-YOUR-QUACK. No, 608-314-8791. Otherwise, you can comment on the live chat on YouTube, Facebook. I don't monitor the others. Hero might be monitoring the others, but call or do the live chat on YouTube or on Facebook. So, Tanya in Portsmouth, New Hampshire. Last week we had someone from Maine.
Mm-hmm.
This week we have someone from Portsmouth. Notice I didn't say Portsmouth. They get upset when you say Portsmouth.
I would think so.
Hey, are you from Portsmouth? No, I'm from Portsmouth. I have a Lyme diagnosis, and I'm having trouble managing some of my joint pain. I'm doing an anti-inflammatory diet and have been treated by my doctor for years using antibiotics. A naturopath suggested curcumin and fish oil to manage pain. Is that the best that there is?
Acupuncture.
Acupuncture is going to be really helpful to manage the inflammation in the joints. It's going to be really helpful to manage the blood flow to and from those joints. Now, the tissue that's in question is non-vascular tissue, but you also have tissue all around there that needs blood flow. And even though the blood flow doesn't go directly into the non-vascular tissue, there's still a connection. The blood still pulls stuff away from there, still brings nutrients to it. So you need that acupuncture to help manage that inflammation. Now, most of the time, people are not taking enough fish oil when we're having a situation like this. A good friend of mine, he's a naturopath up in Madison.
What is the name of that clinic again?
Family Clinic of Natural Medicine. You've
Okay.
got Dr. Aaron Henkel, Dr. Rebecca Georgia. I always want to have dark glasses on when I say that. And then you've got Dr. Robert Coleman, also known as Roberto. Well, at least that's what I call him. He hasn't punched me out yet for that yet. So Dr. Coleman is the infectious disease and Lyme expert up there. When he deals with some of these folks, he usually puts them on a very bulbous dose, a very high dose of fish oil. We're talking between 4,000 and 6,000 milligrams a day of fish oil. That's a lot. That's a real lot. So that's real big. Did I ever tell you that story? I'll tell you later. So in order to, most of the time people are put on a dosage of fish oil, and it's a couple hundred milligrams. Take this pill. Take this teaspoon. No, if you're going to do it and you're going to use it to help manage inflammation, you should take a good dose. When I'm treating patients with severe joint pain, we also want to find out, is it the Lyme, is it the Bartonella, is it the Babesia that's causing grief? Telling you right about this time, we're right under the full moon, or it was either last night or the night before. So sometimes even that week leading up to it and that week after it, pain can start ramping up. So keep an eye on that, because that could be worms causing inflammation around the joints. It could be Babesia, little single cellular organisms, protozoa, Babesia in there causing grief. In either case, someone needs to get to the bottom of it and take a much closer look at what's going on. So I would say either find a practitioner that is going to dig in a little deeper and has a few more tools to work with, or talk to your naturopath and get that fish oil boosted. Now, is that the best that there is? No, there's not. There's plenty of other options out there. I use a formula from Evergreen Herbs a lot to manage pains called herbal analgesic, herbal ANG. And it's a blood-moving herb, and it also takes care of that pain. And it's not always necessarily the joints themselves that are hurting. I'm just thinking of a Parkinson's patient I saw this morning for whom had a lot of joint pain. Tissues were always clamped up, and she's more advanced Parkinson's, so her body's kind of doing this. And had a long, hard talk with her last week about taking her herbs. And then I gave her something called Calm ES, again from Evergreen Herbs, a patent formula. Calm ES is typically used for stress, psycho-emotional situations. Chinese would say liver, qi, and heart fire situations. But it's also got some really wonderful antispasmodic qualities. So last Tuesday, I saw this lady a week ago.
Mhm.
She came in today, no spasming. Her joints are feeling a lot better. Why? Because all of that tissue that connects to and around the joints isn't tight, pulling them apart. So you need a practitioner that's going to look and decide what's going on. Is it a musculoskeletal issue? Is it a non-vascular tissue issue? Where is the inflammation and what's going on? So in answer to your question, Tanya, is fish oil and curcumin the best there is? No, they're good tools, but there's a lot more out there.
Mhm.
And just like we see this all the time, just like with a regular, say, a car accident victim who has neck pain,
Whiplash. Yep.
whiplash. Do you just want one practitioner working on it? Well, if that's the only literate practitioner around, yeah. But we've got that's right. I've got a great announcement later.
Oh, do you?
We've got some pretty good physical therapists in the area.
Mhm.
We've got you, a phenomenal chiropractor. We've got me, an acupuncturist.
Mhm.
When you can get these disciplines that are very, very good at what they do, they can think their head outside of a wet paper sack. That's
Work
always
well
a good
together.
sign. They work well together. And they're not so territorial that, hey, don't you put my patient on any herbs. What are you talking about?
I take your herbs. I gotta get some more, actually.
You want a team that's going to work well together. Someone that's not just going to rely on one or two things, but they can come together and say, okay, the fish oil and the curcumin's not working. What brand are we looking at? Well, I just told them to go to Walgreens, and they went and got the Walgreens brand. Okay, let's start over.
Orthomolecular is much better.
We go through orthomolecular here. We recommend their products. They're clean. They're a good company.
Not getting fishy burps.
You're not getting fishy burps like you do when you have that King George sardine sandwich every Thursday afternoon.
Because you can, if it's either too old or not pure enough.
Well, yeah, if that can's been sitting out long enough, or particularly the sardines and the mustard sauce. I hate sardines. Okay, never mind.
Some people probably didn't know that, though. There is a difference in fish oil.
There is a difference. There's a huge difference. Which is, again, why we always go with the orthomolecular brand. There's tons of brands out there, but orthomolecular has a lot of good research that's been done on their products, been done on their formulas. They've done their homework. They've made a great product. They're a company with integrity. Why am I not going to go with them?
Right?
No, we're not sponsored by Orthomolecular. But Orthomolecular, if you ever watch this and you want to sponsor us,
we love your products.
Won't grunt and crawl for anyone. Or maybe.
What you got?
Well, that lost us a viewer.
That was orthomolecular. They're like,
No, that was probably standard process.
That's okay.
They don't like us anyway. Okay. Do you want to read Glenn?
Okay. Glenn from Santa
Glenn
Fe.
with 2 N's.
Glenn from Santa Fe, New Mexico. I'm told there's a link between ED and heart disease. Is that true? And if it is, what can you do about it?
Number one, Glenn with 2 N's. I love Santa Fe. It was the first time I ever saw Walmart in Adobe siding.
Oh, that's cool.
It's the Adobe stucco. Everything in Santa Fe, it's zoned that they all have to have that Adobe look. The Walgreens, the Walmarts, Popeye's Chicken. Santa Fe is a beautiful town.
That's cool.
My parents lived there for a little while, and they actually lived up in Los Alamos as well, which is up in the mountains. That's where the National Nuclear Lab was. Not because they were scientists or anything like that. Dad actually worked in a retail there. But what a beautiful place.
Cool.
Do you want to tackle this?
Yeah, I would say, yeah, there's definitely a connection between heart disease and ED, because if you're not getting the blood flow to, arms, legs, everything else, it's gonna affect that. You need to have good blood flow. So
heart disease is cardiovascular disease.
mm-hmm.
So if there's poor blood flow, you've got to cause vasodilation,
Mm-hmm.
relax that vascular system, and if there's a bunch of plaque in there, calcification of the arteries, there's an autoimmune situation taking place in the vascular system, and you got to get to the bottom of that.
Mm-hmm.
A couple of different options for what's going on there. You need a competent practitioner to look at it. First thing in acupuncture that we do is we cause that vasodilation. We work on the Xiao Yin and the Zhui Yin vessels, heart and liver, kidney, pericardium, that balance. And we start going for that global vasodilation. We get you on herbs that cause vasodilation. We make the distinction. Do we need to clear some allergies to some minerals to cause that calcification to go away?
There you go.
Is it, do we need to add more lecithin into the diet to get that cholesterol that sticks around out of there? Well, you've got to be on a statin drug. No, you don't. No.
It hurts.
How many times?
You can feel it. The patients will complain that they hurt all over then.
Yes. How many times have you gotten a new patient in
Mm-hmm.
and you look at their medication list and you say, it started with a statin drug, didn't it? How long have you been on it? Well, I've been on that for 20 years. Okay. And then you went to this one, right? Well, yeah. And then we went to this one. And suddenly you're down the road and now you're on metformin. And
Mm-hmm.
well, how did you know? Because it happens all the time. So, number one, there is a direct connection between ED, erectile dysfunction, and heart disease. And in Chinese medicine, when I'm needling a guy who's having heart disease issues and vascular problems, I will often needle around the nose. I don't want to be droll, but I do a lot of body imaging in my needling. And so we'll needle opposites. Nose would be opposite. And what I find is that causes greater blood flow into the phallus. The guy starts having less problems. But that's just watching the symptom and using the symptom as a metric of what's going on elsewhere in the body. Using the symptom, the ED, as a barometer.
Mm-hmm. How well is the system doing?
How is the system doing? And that's what a good practitioner is going to do. They're going to look at your symptom. Your back pain brought you into Dr. Noel.
Mm-hmm.
But maybe there's something deeper going on.
Could be kidney issue.
Could be a kidney issue. And maybe by treating the innervation to the kidney, she's treating your back pain, she's bringing your symptoms of your back pain down, but she's also using that as a barometer for what's going on with your kidneys, using her other diagnostic skills to determine kidney strength and kidney function.
Mm-hmm.
That's what you want in your practitioner. One of my mentors said, they're coming into you for their back pain. They don't care that they have liver qi stagnation. What is liver qi stagnation to them? They don't care. Fix their back pain. And while you're doing that, fix these other things and keep an eye on these other things, because the root cause is the root cause. If you don't fix it, you're going to have that problem again. Our job is to identify root causes and fix it.
Why you're having it.
Which some people don't really want to know what the root cause is.
Yep.
You notice that?
Mm-hmm.
And you tell them what it is and they say, get out of here. Wait, no, that was my mother that said that.
No, some don't.
You're 16 years old, Mo. That's close enough to 18. Get out of here. So, are we far enough? Do you want to do the conundrum? It's 20 after. Are you up to doing last week's conundrum?
The answer for that one?
Yeah.
Yeah.
Read
it?
Are you excited?
Maybe.
You don't look it.
I heard we got somebody.
You don't look it.
I heard we got somebody that answered.
We did.
That's exciting.
Somebody actually came in yesterday, a patient, and said, I have the answer to the conundrum last week. And I said, really?
Really?
Let me read it.
Please. This was the Zumba girl.
Yes. A 35-year-old female gained weight after pregnancy and found it difficult to take the weight off. After beginning daily Zumba and faithfully attending set exercise class for 30 days, she went from a size XL to a size small t-shirt. In the past, she would commit herself to diet and exercise, lose the weight, and within a couple of short months, the weight would return, and often a greater amount. Why would her weight fluctuate so much?
Okay. Chinese diagnostic. Are you ready? The only Jew in history that has no rhythm. That's me. No, don't look at me. I am the only Jew in history with no rhythm.
No.
I can't even balance a checkbook. I'm a failure as a Jew. The rest of the tribe looks at me and says, no, don't say it. Don't say it. But then I put my little kippah on and they say, oh, yeah. In Chinese medicine, this poor lady's pathogen is damp accumulation, which is caused. Damp accumulation is lymphatic stagnation. Okay, it's caused by a chronic infection. Now, Mr. Yitzhak, his name's Isaac, but it's a Hebrew name, it comes from Yitzhak, said, the pathogen is fungus amongus, TCM, dampness. Ba-da-da! We have a wiener. You, Mr.
Correct.
Isaac, I'm proud of you. You have won a Hebrew national wiener. No, you haven't. You've won $10 in the Siloam Center Apothecary. Congratulations. That's phenomenal.
It is. He was right on.
Phenomenal, as Dr. Jen used to say in med school.
Did good.
Very good. I'm proud of you, Yitzhak. Yes, dampness accumulation. But the problem is this woman was getting her lymphatic system moving by all of that exercise, which got the lymphatics to start draining, and she started dropping the weight, but she never took care of the infection in the first place.
The root problem.
The root problem, which means as soon as she slows down on her exercise or stops exercising, she swells back up. The poor thing needs some serious help. Because in time, what does stagnation cause?
Cancer.
Stagnation will turn into cancers. And when you're having lymphatic stagnation, you really want to be wary of lymphatic type cancers, breast cancers, leukemias, things like that.
Mm-hmm.
So that was actually a real life conundrum that was taken from patient files of the LAPD. No, that was Dragnet.
That's impressive going from an XL to a small, though.
That shows you the extent of
How bad the problem
the
was.
lymphatic system. How badly damaged this poor lady's lymphatics are.
Crazy.
Did you see how? I mean, this wasn't made up. This was legit. Do you see how flexible the body is in managing its attacks?
Mm-hmm.
when you start treating some of these people and you see how much the body can endure and still survive.
Mhm.
I think of a couple of parasite patients that have been passing parasites daily for months. How does one survive with all of that in them?
Body's amazing.
The body is amazing. King David, you are fearfully and wonderfully made.
Mhm.
When God designed us, he was so merciful in how he designed us to give our bodies this kind of ability to
Adapt.
and survive. Wowee! That's incredible. Okay. You want to read Tammy?
Yes.
Isn't there a song about Abilene?
I know there's a song about Jolene. Abilene, Jolene. I don't
Jolene, Jolene. Yeah, but that's Tennessee. We're in Texas now.
All right.
The
So
great state of Texas.
Tammy from Abilene, Texas. That's probably how she says it. I am very sensitive to eating grains. My allergist tested me for food allergies, and I am not allergic to grains. My naturopath did the U.S. Biotech Food Sensitivity Panel, and I am not supposed to have problems with grains. Why do I get so sick when I eat grains when I am not allergic or sensitive to them? I would say glyphosate.
Very good.
I think that's a lot when you see these and they're not testing. They think they're celiac.
Yep.
And then shows that they're not celiac, but they're still obviously having problems. I think the body's just trying to get rid of the poisons that are on the grain.
Do you remember about 10 years ago, there was this really strange phenomenon where people who were diagnosed celiac here in the States, when they'd go on vacation to Europe, they could eat gluten without having a problem?
Really?
Yeah.
Because they have different pesticides?
They don't allow glyphosate over there.
So it should be. We're killing ourselves.
Very interesting. So, Tammy, she's right on. I think you are right on. Number one, I'm very happy that your naturopath is using the U.S. Biotech Food Sensitivity Panel. It's a very good test. Have you seen it?
Mm-mm.
They're measuring 96 different foods. And it's not necessarily going for a specific food, but 96 different foods that are representative of several others that are very similar. And so the brilliance of how the test was designed. So you end up with classes of foods that you need to either avoid or you're fine.
Mm-hmm.
So if it's coming back that your IgG immunoglobulin, I said that wrong.
I'm an acupuncturist, not a miracle speech pathologist, Jim.
Can you tell I've had coffee?
Yeah, you've had the good stuff today.
Wow.
That was from our buddy Ron, right?
Yes, Ron. If you ever do watch this, thank you. When your food sensitivity panel is coming back that your IgG sensitivities aren't even there for the grains.
Mm-hmm.
And when your allergist is saying, no, you're not having an IgA reaction either. What's so cool, I had a patient a couple weeks ago. The poor kid, she got sick every time she ate, knew that she needed to stay away from gluten and grains, and the poor thing was just limited to a couple things she could eat. She was always living with feeling like she had ground up glass in her gut.
Mm-hmm.
So I tested her NAT. I went through the basic 17. Grains weren't an issue. Corn wasn't an issue. Wheat was not an issue. Tested for gluten specifically, not an issue. What was the issue was the glyphosate.
Mm-hmm.
So I treat her for her allergy to the glyphosate, and what happens?
She can eat everything again.
Bing, bing, bing. She stops having stomach aches. It was as simple as that. Then we go through and we start treating everything else. All of the other allergens start disappearing. So, Tammy, find yourself somebody that does Nambudripod's allergy elimination technique. Wait a minute, Quackwatch says that's phony. Quackwatch is it's edited by a bunch of idiots. Would you agree?
Yeah.
They're edited by a bunch of idiots with an axe to grind, and they're getting paid to grind that axe.
Those are called trolls.
Well, that's one word for them.
That we're allowed to say trolls.
That's one that we're allowed to say on a family program.
Mhm.
No, Nambudripod's allergy elimination technique. We did a whole show on that once.
Mhm.
NAET. It's not mystical. It's not magical. It's not energy of the. No, it's dealing with your body's fight or flight response to the natural frequency of certain stimulus. And you can shut your body's fight or flight response off by stimulus to nerve roots. Why wouldn't you do that? It's the single most underwhelming therapy that you'll find. But you know what?
It works.
It works. When you shut off the body's fight or flight response,
World is your oyster.
that's disappointing because I don't eat oysters. So, Tammy, I would say look up in your area within driving distance to see if anybody around does NAET. You can actually look up the website for Dr. Devi Nambudripad and Dr. Roy Nambudripad to see mother and son. Brilliant family.
Cool.
Genetically, those people have to carry their brains in a wheelbarrow because they're just so heavy otherwise. Brilliant people. MD, PhD, doctor of chiropractic, doctor of acupuncture, doctor. I think Roy might even be a doctor of pharmacology.
Wow.
Brilliant, brilliant people. Multiple PhDs. Look on their website. They should have a practitioner look up, and you can find somebody in your area. They might not treat it as though it's a simple fight or flight response medicine, neuroimmunological medicine, but that's what it is. They practitioners have the license to be able to interpret it differently and treat it differently. It is what it is.
Mm-hmm.
So,
do you want to read Julio?
Well, do we want to read Julio down by the schoolyard, or do we want to do this week's conundrum?
Do we have time for both?
Let's do the conundrum first.
Okay.
And then we'll do Julio, and hopefully we'll get to Taka.
Okay.
Julio in Billings and Taka in Buffalo, with Paul in Muncie, Indiana on deck. Wow, we have a whole lineup yet. Isn't that amazing that this humble little medicine show on YouTube gets around?
It does.
Someone actually told me yesterday that they look forward to it. You are really hurting for entertainment.
Oh boy.
It's educational. Yes, it is.
Mm-hmm.
This week's conundrum. Dr. P. Diddley Schmoozer, MD, PhD, DOM, DDS, and Eagle Scout. I mean, this guy's a go-getter. He's a humdinger. Was listening to his patient complain about his tinnitus. I'm assuming the patient's tinnitus. I wrote this, and that was poorly written. He was listening to his patient complain about his tinnitus. The patient talked about the intensity and the volume. The patient said that he had his hearing assessed recently and had no hearing loss. Dr. P. Diddy Schmoozer, MD, PhD, DOM, DDS, and Eagle Scout, asked the question, what does the tinnitus sound like? Ooh, that's interesting.
Mm-hmm.
Does it sound like, now we know Dr. P. Diddley is a poet, does it sound like cicadas in the summer, long around July 25th?
Yeah.
Or does it sound like the waves at the seashore? The patient immediately said cicadas. Now here's the wry twist. What vessel, what vascular bundle, what vessel did Dr. P.D. Schmoozer, M.D., Ph.D., D.O.M., D.D.S., and Eagle Scout treat? That's exciting. Number one, I always get a little heartsick when someone calls up and says, "Do you treat tinnitus?" Because most of the time it's hearing damage. But when you get somebody who they had their hearing checked out, it's not hearing loss, there's something going on, then you say, yeah, come on in, let's treat it. And then you have to ask these constitutional questions to determine what's going on. But the beautiful classical descriptions of cicadas in the summer or waves at the seashore.
I've only had the cicadas sound when I get it. I've never had the waves. Have you had the waves?
I have not. I just love the elegance of classical Chinese medicine. It's not that it's simple and bonehead, it's elegant. And something that is elegant can be so complex.
Mm-hmm.
I just love that. So, if you think you know the answer to Dr. P. Diddley Schmoozer, MD, PhD, DOM, DDS, and Eagle Scout, then write it on
A Post-it.
a Post-it note, folded into the shape of an SR-71 Blackbird, and fly it to 839 Harding Street, Siloam Center, the Conundrum, care of Siloam Center, 839 Harding Street, Janesburg, Wisconsin, 53545. Super cool.
Man, that caffeine for you.
We have too much fun. Okay, we have 22 minutes for Julio.
Julio.
I've already insulted the man by saying he was down by the schoolyard.
I just like saying it. It wasn't a diss. It was just Julio.
When I was a kid, and I know I've always got a dumb story about this stuff, but when I was a kid, my violin teacher, she was a Belgian lady who had married a guy from Cuba who was high in the Bautista administration. And when Cuba fell, he fled to the U.S., took the Bar Association, became an attorney over here, and ended up being a federal judge.
Oh, that's cool.
His name was Julio.
Neat.
So whenever someone says Julio, I always go, because he
Julio's
scared
got
me.
power.
He scared me. The man exuded authority. He was neat.
That's cool. Would you like me to read it, or do you want to read it?
Yeah, go ahead and read.
Okay. My 6-month-old daughter is teething, drooling, had white in the back of the throat, and had 100-degree fever. The pediatrician did not believe it was COVID. The next day, my daughter was covered in a rash and was very fussy. She was not soothed by her bottle, which she loves. The pediatrician said it's most likely a virus and that has been in her system for over 7 to 14 days. They tested her for COVID. Are there any other viruses that can cause a body-wide rash?
Oh, yeah. There's tons of viruses that can cause body-wide rashes. Also, you've got that coating in the back of the throat. I think fungus. I would check out funguses. In addition to viruses, I would look for funguses because, well, how would a fungus cause a rash? The fungus itself might cause a rash, but also the amount of biotoxin that the fungus is throwing into the body can cause a rash. Is the rash raised? Is it itching? Is it burning? Is it weeping? Is it...
Now, can teething kind of irritate that stuff too?
Teething can cause that too, because teething can cause a decrease in immune function and kind of mix up the immune system. So then that begs the question, how do you test for this stuff on a baby? How do you treat for this stuff on a baby? I've got a little one right now. Same scenario. Poor thing, her little face was all covered, all down her body.
Were the arms rashed?
Trunk and groin area.
That's the
and
same
face.
for this one. Nothing on the arms.
So what we did was we checked her with NAET, and we found out that in this little one's face, in this little one's body, it was viral. There wasn't the coating in the back of the throat.
Okay.
In this little one, it was viral. And so we have a couple of options. We can either use a generic vial of different, I'm going to have some fun, coronaviruses, colds, flus, things like that. Or in this case, I actually took a swab of the nasal mucus that was coming out and made a vial out of that. Treated baby for the virus present in the nasal mucosa, and within 24 hours, the rash had dissipated by 50%.
That's pretty nice. Mom's got to be really happy. Mommy and Dad.
She was until the illness flared again. It's a chronic viral infection in this little one. She's, I think, 7 months old, 8 months old, and already has a chronic viral infection.
Wow. It's
a pretty dirty world that we live in. Picked up a bad cold from her brothers and sisters. Viral colds can do this. We know very little about colds. Very few people actually study cold viruses because they're not life-threatening. They're not a big deal.
Mm-hmm.
But think about it. How many people get affected by colds? Everyone.
Yep.
What are the long-term effects of cold viruses? Has anyone gone through and actually classified taxonomically cold viruses? I don't think so.
I don't think so either.
Nobody's doing it. We're going after the life-threatening stuff, but maybe some of these cold viruses can get in there and just kind of simmer, and maybe they're producing some long-term problems.
It could be.
We're
Sure.
seeing it in these little ones.
Mm-hmm.
So whether it's viral, whether it's fungal, whether it's bacterial, it needs to be identified. In any one of those cases, it can be treated. This week, I sent Mama home with an antiviral Chinese formula. Little one's not eating solid yet. How are you going to get her to take it? Told Mama to pump some milk, put the capsule into the bottle of milk, cut it in half, and give that to the baby in the morning, and give some more in the evening. Baby's a large enough little kiddo, she can handle a capsule a day. Other babies might not, so we might have to cut it back for them. But that's where the practitioner needs to be dosing, not you, the practitioner. Because sometimes these little ones need the help of the herbs.
Mm-hmm.
Sometimes they need something to boost the immune, sometimes they need something to focus the immune system. But the NAT can work wonders on little ones.
That's good. Yeah, because there's plenty of them. I know teething is a big one. We could probably do a whole show on teething.
We could. We had a ranch hand with no teeth. And
You told me about some of them. They ate out of coolers that, as long as it didn't get up to like 98 degrees or something like that, it's all good.
did we kind of answer that?
I think so.
Okay. Taka in Buffalo. I had a colleague once named Taka. Beautiful, brilliant practitioner. Ended up dying of cancer, losing her fight against cancer. I recently went to a local acupuncturist for help with my neck. I was in a car accident 2 years ago and have had very bad neck pain since. The acupuncturist helped for a few hours and my pain was about 30% less, but then the pain came back worse than before. Is this a normal thing or did they do something wrong? And they put the needles in my neck and in my hands. Okay. What do we call that when the pain gets a little bit worse after treatment?
What do we call it? Messing with something that's already injured to make it better and it flares up.
We call it a healing crisis.
Yeah.
So is it a horrible thing that is happening? It's miserable for the patient, but it's not necessarily a horrible thing. I actually talked to a patient about this morning, newer patient, brand new patient, similar situation. She's never had acupuncture before, but I want to be upfront with my patients and say it sometimes can get worse before it gets better. Here's why.
If you've been sitting on this for 2 years,
Your brain's only going to put up with so much noise and distraction. And at a certain point, the brain says, I've had all the pain I can stand. We're going to turn the volume down on that pain. I'm going to disconnect from this area. And I'm going to just cut it off. I don't want to talk to it anymore. Think about that sibling that can't stand the rest of the family. What do they tend to do? They tend to cut everybody off. The brain can't stand the rest of the body, so it's cutting off the communication. So then what does the acupuncture do? The acupuncture is reconnecting the brain, the neural pathways from the brain to that tissue. That tissue's inflamed. That tissue hurts. That tissue's been screaming, help us, we need some help. If you're a German. If you're Swedish, it should say, help us, please. I won't go there. The tissue's screaming out the pains. It's always been there. It's just your brain has muted it. So then your brain reconnects and says, whoa, oh, oh, kind of like Rochester on the Jack Benny show when he realizes he was supposed to do something. Then your brain picks up and realizes the amount of pain that's there, and your brain starts kicking in to start the healing process. We call that a healing crisis. Sometimes you got to trigger that. Now, did the practitioner do something wrong? Well, I don't know. I can't assess you, Taka. I don't know. I'm assuming they did not, because this happens. Mm-hmm. Now, when there's
not even just in acupuncture, it happens in the chiropractic field too.
It happens in every discipline of medicine.
Mm-hmm.
Every discipline of medicine. Talk to a physical therapist. It's going to happen there too. Pardon me.
So you're working with irritated tissue.
You're working with
irritated tissue. It's going to tell you, no, I don't like being messed with, but I need it.
And I don't like putting needles where the tissue's already messed up. Why? Because I had a very classical Chinese mentor, Dr. David Chow. And he says, when the baby is crying, you don't slap the baby. I'm glad I wasn't a baby in his house. Oh, you're not crying? Come here, Mo. My parents would have appreciated that. No, he says, you don't slap a crying baby. So why would you put needles in the tissue that's crying? He taught me the importance of going distally. Now that she says that they put needles in her hands, they probably did the 10 by hand treatment. A bunch of extra points across the top of the hand. Why? Because that mirror images the pain. It's really interesting because you take the person's hand and you say, put it on over the pain on the back of the neck here. Okay, I've got pain right here on my mastoid. And okay, so then we put the needle right in here and wow, the pain's gone.
I heard for your feet too, though, that you can do that.
I use feet, I use neck, I use feet, I use hands, I use wrists. You can mirror imaging again, body image. Mm-hmm. If this is your head, back of the head, the mastoid right in here, go right into from Sanjal 4, angled across into large intestine 5.
How do you pick between right and left? It just depends on the side where the pain is, or?
It can. Oftentimes, if the pain is on the left side, I will do left side on the back of the hand.
Okay.
The other aspect is sometimes I'll use the knees, the proximal portion of that knee. That if there's a problem in the mastoid, there's a beautiful little nodule right up here on the knee, and you can palpate where that ligament connects, that tendon connects, and you can needle right underneath it. And all of a sudden, all of this tightness and inflammation around the mastoid just kind of melts. And the patient said, "What did you do?" It's so much fun to do.
Like I'm good at what I do.
So normally I would want to see more than 30% reduction in pain. Normally I'd want to see at least 50%.
It is an older injury, though.
It isn't, well, not at 2 years.
Well, it's been lingering for a while. They didn't come in right away.
Yeah. And there is a general rule for therapy, and that is for every year of injury, you've got, 3 months of therapy?
In best case scenario, if it's not getting re-aggravated.
Yeah. So the point with that is when you get hurt, go in and get care.
Mm-hmm.
Don't wait. You're going to make it take much longer to treat. So did they do something wrong? Probably not. Probably not. It's a lot harder to mess things up back there, putting needles in, than you might imagine. The worst case scenario is they might have nicked a vesicle or something and caused a small hematoma that's pressing and acting as a space-occupying lesion now. That can cause some pain. You can get that in the hands sometimes, but then you get it up here where there's a lot of nerve roots and things. That's worst case scenario. But again, I don't put needles up there for that very reason, because you've got the tissue already inflamed.
Mm-hmm.
Did they give you any herbs to manage pain? Did they give you any herbs to manage that healing process? If they did not, find an acupuncturist that incorporates herbs as well. Are you ready for a really cool announcement?
Yes.
I have a friend who is a physical therapist in town.
Very nice.
She's not your run-of-the-mill physical therapist either. She does a lot with neurological stuff.
Cool.
She is going to come on to this program in January.
Very cool.
She's going to spend an hour with us, as it were.
Very nice.
Answering your questions. So when we get a date solidified, we should have that this week. We'll announce it next week.
Good.
So put your physical therapist questions to the side, put it on a Post-it note, post it on the wall, be ready, because in January we will have our first special guest practitioner.
Cool.
We had a patient once. We'll have our first special guest practitioner to join us and answer your questions.
Very nice.
That's exciting.
It is.
So, I think we're going to get through all of these today. We have 6 minutes for Paul in Muncie, Indiana. Do you know where Muncie is?
Mm-mm.
I've always kind of giggled when I heard the name Muncie. Go ahead.
Okay. My kids don't like to brush their teeth because regular toothpaste burns their mouths. As a result,
It burns in what a world. Sorry.
As a result, they always have problems when they go to the dentist. Do you have any recommendations for something that they can use that won't burn their mouths? Can they pull coconut oil?
They can pull coconut oil, but coconut oil isn't going to get the plaque off.
Mm-hmm.
The brushing needs to happen. Brushing with just water will get the plaque off. You can brush with baking soda. But there is something to be said about brushing with something that is going to be killing bacteria and microbes in the mouth and promoting healing of that tissue.
Propolis.
Both the hard tissue and the gums. Say that again.
Propolis.
Say it again.
Propolis.
Say it again.
Be propolis.
Woo-hoo-hoo! Yes. Be Rescued Propolis toothpaste. Can't tell you how many times I've heard this same thing, where kids were getting cavities left and right, and they just couldn't handle toothpaste because of the sodium lauryl sulfate. They were allergic to the sodium lauryl sulfate, and their mouths would break out and they'd be burning. and mom and dad would be at a loss because the kids would be trying to brush their teeth and they'd be crying, and it was just miserable.
Mm-hmm.
So then you give them the bee toothpaste. And we don't own Be Rescued. My wife and I formulated it. We used to. We no longer the owners of it. Beautiful family up in Ripon, Wisconsin owns it now. So it's a small family that owns it, small family that runs it. It's still a great company. The products are phenomenal. And it was designed for a patient who had post-cancer treatment, Lyme disease, and he was losing his teeth. And
Needed something.
Couldn't stand the crest and everything else, so he needed this. So we made it, and it helped. And over the years, I've heard time and again where these little ones are having the same problem as you, Paul, where they can't handle the toothpaste. And I mean, you look at the label on toothpaste, why does it have the phone number for Poison Control Hotline? You notice that?
Yeah, that's true.
So, Be Rescued Propolis Care, you can get it at berescued.com.
Or here.
Or if you're in the area, but Muncie to here is a long way. So,
Unless you win.
we're not shipping you over here. You have just wasted another perfectly good week watching Chat with the Docs, and we thank you for it. We're glad you don't have better taste in entertainment. Infotainment. This would be infotainment, wouldn't it? We're glad you don't have better taste in infotainment, so thank you for joining us. Do you have anything going this weekend?
Not this weekend. I do have to say, though, for the audience, I will not be here on Tuesday the 22nd. That's that week before Christmas. So you guys might have to take over.
Actually, I think we'll just cancel it.
Okay.
So the week of the 22nd, there will be no Chat with the Docs. I'm sorry.
So you got next week yet, though.
You got us next week, but then we're going to have a week off, and I think I'm gone the following week, so we might have a couple weeks off.
Revamp and re-energize.
Re-energize, and Hero might do a best of, but because you don't want just me on this show, that's no fun. We gotta have you.
Oh, the physical therapist won't be.
No, she'll be coming for one visit in January.
Oh, okay.
So, Rebecca.
Okay. What's Rebecca's last name?
I'm drawing a blank. You'll have to forgive me.
No, it's okay. I'll ask you later.
Okay.
I gotta friend her on Facebook then. Find out more about her. Check her LinkedIn.
You do LinkedIn?
You know I have it, but I don't know if I can log in.
I don't think I've been on LinkedIn in years.
I don't quite know how to use it all the way, but
anyway, thank you for watching. Mercy Joy, if you're watching, I've got to finish up some charting and call a couple patients, and I thought I'd go find Zeko some boots, some shoes, because he's wearing mine and they're too small for him, and I'd kind of like to have some shoes back. So till next week,
okay,
au
guys.
revoir. Have a great week and be well.
Bye, guys.
Shalom.